Hello students, welcome to Anatomy 2024 November INI-CET recall questions. Now from Anatomy, this time we got 16 questions. Out of 16 questions, 14 questions were repeat and 2 questions were brand new questions. Again, Anatomy questions were simple. Again, they didn't give anything from the multiple answer type. They didn't give any question from the sequential arrangement. All the questions were simple, factual, applied and the image based questions. Now we see one by one. We start with general embryology. Now, in the general embryology, the first question, the mitochondrial sheath are found in which part of sperm? A. Tail piece, B. Middle piece, C. Principal piece and D. Connecting piece. Now, see the diagram. This is an image of a sperm which contains the head and the small neck part and the tail piece. Now, the tail piece which is divided into 3 parts, middle piece or mid piece, principal piece and the terminal piece. Now, middle piece or mid piece is called powerhouse of the sperm. Now, why it is called powerhouse? Because it contains numerous mitochondria. Now, principal piece, that is helping for motility. Right. So, now we know the answer. The mid piece or middle piece, it is called a powerhouse because it contains mitochondria, and B is the answer for this question. Next question. In which stage of meiosis is the primary oocyte arrested? A. Diplotin, B. Leptotin, C. Zygotin, D. Pachytine. Now, see the diagram. The primordial germ cells reach the genital ridge in female by 5th week, and the primordial germ cells immediately converted to oogonium. Oogonium, by mitosis, it is converted to primary oocyte. Now, the primary oocyte enters meiosis 1. The primary oocyte which is entering meiosis 1, it is go to resting phase called diplotin phase. Now, it is in the diplotin phase until puberty. After puberty, the meiosis will resume and in turn forms secondary oocyte and first polar body. So, primary oocyte at birth, it is present in diplotin phase. Right. Now, secondary oocyte enters meiosis 2 and completes prophase, and secondary oocyte in the metaphase arrest. How long? It is in the metaphase arrest only for 24 hours. So, please do not forget. So, now what is the answer for this question? They are asking about primary oocyte in which stage is arrested? It is arrested in the diplotin phase. Now, what about secondary oocyte? Secondary oocyte in the metaphase arrest for 24 hours. So, answer for this question A. Diplotin. Third question. Which of the following is first formed by the migration of epiblast along with the primitive streak? So, they are asking about gastrulation. Now, gastrulation and neurulation are the event of which week? 3rd week. Now, formation of primitive streak indicates the beginning of gastrulation. Now, primitive streak, again we got one question for the primitive streak identification in the exam, November exam. Now, primitive streak, I told you to remember 3 points. Primitive streak is a structure which is formed at the caudal end of the embryo. Now, primitive streak is coming from proliferation of epiblast cells. Epiblast proliferation. Now, primitive streak which is formed by the 14th day or 15th day, that is by the end of 2nd week or beginning of 3rd week. Formation of primitive streak indicates beginning of gastrulation. These are 3 points you have to know about the primitive streak. So, now the gastrulation, what is the first germ layer to develop? The first germ layer to develop is the endoderm. Endoderm is coming from epiblast, and what the endoderm will do? Endoderm replace all the hypoblast. So, from 3rd week onwards, we do not have any hypoblast. All the hypoblast cells are replaced by endoderm. Now, second germ layer is a mesoderm. Mesoderm is derived from primitive streak. Primitive streak, just now I told you, it is coming from epiblast. So, primitive streak forms the mesoderm and mesoderm is a second germ layer to develop. Now, after the formation of mesoderm, then the remaining epiblast will form ectoderm. So, ectoderm is the last germ layer, third germ layer to develop. Now, endoderm, mesoderm and ectoderm, all the three germ layers are coming from epiblast. Now, again in the next INI-CET, they may ask you this question: arrange the germ layer formation in a sequence: endoderm, mesoderm and the ectoderm. So, in the question they asked you what is the first germ layer to develop, that is the endoderm. That is the answer for this question. Right. Now, next question: which of the following not a derivative of the neural crest cells? Now, they gave theory question. Now, in the 2023, they gave image based question. They gave the neural crest cells in the electron microscope image, and they asked you to identify the derivatives of the marked structure. So, now 2024 November INI-CET, they give theory question: which of the following are a derivative of neural crest cells? Now, we have a mnemonic. I told you motile pass is a mnemonic for the derivatives of the neural crest cells. MOTEL PASS. What is M? Melanocyte. O. Odontoblast. T. Tracheal cartilage. Enterochromaffin cells or adrenal medulla. Laryngeal cartilage. Parafollicular cells. Pseudo-unipolar cells. All the ganglions including adrenal medulla, Schwann cells and the spiral membrane. So, the structures you have to remember for the neural crest derivatives. Now, ganglions, just now I told you, all the ganglions are coming from neural crest cells. So, C is a derivative. Melanocytes derivative. In ciliary muscles, ciliary body, they also coming from neural crest cells. Retina is not derived from your neural crest cells. So, answer for this question is retina. So, retina is not a derivative of neural crest cells. Now, please remember retina, optic nerve, they are the continuation of extension of diencephalon. Diencephalon is coming from neural tube. Now, neural tube is coming from neuroectoderm. So, retina, optic nerve, they are coming from neuroectoderm. Retina is not derived from neural crest cells. So, answer for this question is retinal pigmental epithelium. It is not a derivative of neural crest cells. Retina and optic nerve, they were the derivative of neuroectoderm. They were coming from diencephalon. Right. So, next question: which mechanism is responsible for release of secretion from the marked gland? And this question they were asking repeatedly in the INI-CET exam. Now, see the diagram. Now, in the diagram, you are seeing this gland. Now, this gland, the entire gland is disintegrating and giving secretions. So, based on secretion, we know three types of glands available. What are those? Merocrine glands, apocrine glands and the holocrine glands. So, merocrine glands, the vesicles releasing the content by exocytosis. Here the cells are intact. Apocrine gland, the apex of the cell is pinched off and give the secretion. Holocrine gland, the entire cell disintegrate and give the secretion. Now, example for holocrine gland, sebaceous glands, apocrine glands, mammary glands, and atypical sweat glands in axilla and pubis. Example for the apocrine glands. So, apocrine gland example, I told you MAP is a mnemonic, apocrine glands. So, M mammary gland, A and P, atypical sweat glands in the axilla and pubis. Merocrine glands, sweat glands are example for merocrine glands. So, now by what mechanism? See here. So, you are seeing many layers of cells and the entire cell disintegrating, releasing its secretions, and the basal cell in the sebaceous gland are mitotic. They replace the disintegrated cells. So, what is the answer for this question? Holocrine gland. Very simple and easy question. Identify the marked structure: A primitive streak, B notochord, C neural groove and D secondary neural plate. So, see the marking. Now, they give the histology image and the marking is on the caudal end. Now, this is the cranial end of the embryo. and this is the caudal end. In the caudal end you are seeing the marking. Okay. So now let us identify the cells, and you are seeing some swellings. So what are these structures? And you are seeing some central segments. So we see all these. Next slide. So now in the diagram, yes, the one which is marked, that is the prosencephalon, 3 mesencephalon and 4 rhombencephalon. So these 3 were the brain vesicles. Now these are coming from the neural tube, yes. And see the center. Now in the center, yes, you are seeing some segments. So those are nothing but somites. So somites you are seeing. Somites are coming from, yes, paraxial mesoderm and lateral to somites, and you are seeing some lateral mesoderm, yes. Okay. Now where is the marking? Marking, I told you, the marking is on the caudal end, the caudal end of the embryo. So caudal end, just now I told you, primitive streak, it is the caudal end. So primitive streak is a structure at the caudal end of the embryo. What about the cranial end? Precaudal plate. So precaudal plate, it is a structure formed at the cranial end of the embryo. Now what is precaudal plate? Precaudal plate is nothing but it is a structure formed at the cranial end, yes, and it is columnar hypoblast cells. Usually hypoblast cells are cuboidal. In some areas the hypoblast cells become columnar and they form precaudal plate. Now what the precaudal plate will form? Precaudal plate will form buccopharyngeal membrane or oropharyngeal membrane. The buccopharyngeal membrane or oropharyngeal membrane rupture and form oral cavity. So oral cavity, it is a structure formed at the head end. So the structure where the oral cavity is formed, that is the future head end. Now who is forming the oral cavity? Yes, your precaudal plate. So precaudal plate at the head end, primitive streak at the tail end. Now marking is on the tail end of the embryo. So what is the answer for this question? The marked structure is the primitive streak. Yes. Next, identify the marked structure. So now you have to identify the histology image. Again, very simple, easy question. Already they gave these questions repeatedly in the old AIMS exam. Now see the diagram. So in the diagram, the histology image, yes, that is a cardiac muscle. Very simple and easy identification. Cardiac muscle, easily you can identify cardiac muscle, skeletal muscle. So cardiac muscle, how it is differ from skeletal muscle? Cardiac muscle and the skeletal muscle both have striations, but how it is differing from skeletal muscle? The cardiac muscle, the first and foremost point, they have a branched myocyte. The cardiac muscles are branched. Now the nucleus is centrally placed nucleus, single and centrally placed nucleus. Yes, you are seeing the centrally placed nucleus. And the cardiac muscle, they have one specialized structure called intercalated disc. Intercalated disc, it is present between the neighboring cells. Now what the intercalated disc will do? Intercalated disc allowing the cell to have the synchronized contraction. So these 3 were the main features of the cardiac muscle. So now see the marking, see the diagram. Now you are seeing the myocytes. These myocytes are branched. Yes, you are seeing the branches. And you are seeing single nucleus, centrally placed nucleus. And between the neighboring cells, you are seeing some structure, special structure. So these are nothing but intercalated disc. And that is the answer for this question. Next one, identify the marked structure. So here the marking was given over here. Now what is the marked structure? That is, we have to identify the structure first, identify the image first. Now the slide belongs to, yes, prostate gland. Very good. Prostate gland histology, again very simple, again brand new question, very first time they given this question in the AIMS and INI-CET exam. So prostate gland contains glands and fibromuscular stroma. Very simple. Only 2 components are there in the prostate gland, glands and fibromuscular stroma. Okay. Now glands are made up of, you are seeing follicles. Yes, these are the follicles. So glandular component which contain follicles, So, glandular part which contain follicles. Now, what is the lining epithelium of the follicles? Follicles are lined by secretory epithelium. What is secretory epithelium? Squamous? No. Cuboidal? No. Columnar. Simple columnar epithelium. So, follicles are lined by simple columnar epithelium, and the lumen of the follicles contains the amyloid bodies. What are those? Corpora amylaceae, that is present in the lumen of the follicles. So, lumen of the follicles contains the amyloid bodies or corpora amylaceae. Next, fibromuscular stroma. Now, fibromuscular stroma name itself we have a clue which contain muscle and the connective tissue. What muscle? Smooth muscle fiber. Smooth muscle fiber plus connective tissue present. Okay, this is the feature of the prostate gland, and in the diagram the marking was given here. So, they are given the follicle and we are seeing some substance inside the follicle, that is nothing but amyloid bodies or corpora amylaceae. So, this is the image of the prostate gland. This is a follicle. Now, inside the follicle, yes, here is a marking, that is amyloid bodies, corpora amylaceae. That is the answer for this question. The marked structure serves as the surface landmark for which anatomical structure? Now, again repeat question. Fourth time they are giving this question. Now, the marking is a junction of 4 bones. This is a frontal bone, parietal bone, sphenoid bone and the temporal bone. So, 4 bones meeting at this point, and that point is called pterion. Now, what is the structure present beneath the pterion? I told you to remember 3 structures present beneath the pterion. What are those? Number 1, anterior branch of middle meningeal artery or frontal branch of middle meningeal artery. Now, one bone is present. Which bone? Anterior clinoid process. Anterior clinoid process, it is a part of lesser wing of sphenoid and the stem of lateral sulcus. Stem of lateral sulcus is present beneath the pterion. Now, 2023 November they gave the same question. In 24 November again they repeated this question. So, stem of the lateral sulcus is present beneath the pterion. That is the answer for this question. Intercalated siphon, vernix area, pineal gland, no, these were not present. Answer for this question, C, stem of lateral sulcus present beneath the pterion. That is the answer for this question. Identify the marked structure. Superficial temporal artery, posterior auricular artery, middle meningeal artery and D, occipital artery. Now, see the diagram. So, now in the diagram you are seeing the arteriogram, you are seeing the arteries. Now, this is your common carotid. Now, this is your right common carotid artery, and the right common carotid, it is dividing into this is external carotid artery and this is internal carotid artery. Now, external carotid is giving the 2 terminal branch at the level of neck of mandible. So, this is your superficial temporal artery, superficial temporal artery, and this one is maxillary artery. Okay, and this is the subclavian artery, right subclavian artery, and from the first part of subclavian artery we know the mnemonic. First part of subclavian gives 3 branches. VAT branch, vertebral artery, yes, internal thoracic and thyrocervical trunk. So, this is your vertebral artery passing inside the vertebra, foramen transversarum, cervical vertebra, foramen transversarum, C6 to C1. So, these were some main arteries that identify the diagram. Now, there is a marking. See the diagram. The marking was on the superficial temporal artery. So, that is the answer for this question. It is not posterior auricular, it is not middle meningeal and occipital. Middle meningeal is a branch of your maxillary artery. Occipital artery, no, that is the branch from the posterior part of external carotid and posterior auricular too. So, marking was on the superficial temporal artery. Now, the posterior end of the marked structure is present at the level of which of the following? Now, see the diagram. This section is taken in the coronal plane, okay, or frontal plane. Now, where is the marking? Now, marking was on the nasal cavity, inside nasal cavity. Now, the elevations are called turbinates. I hope you know that. So, the lateral wall of nose, we have turbinates. So, marking is on the inferior turbinates. Inferior turbinates. So, now inferior turbinate, so on the laterals of the turbinate, we have some spaces. Those spaces are called meatus. 1.25 centimeter behind the inferior turbinate, we have one opening. What opening? Eustachian tube. Eustachian tube, it is an opening behind the 1.25 centimeter of inferior turbinate. Okay, and that is the answer for this question. Very simple question, easy question they gave in the INI-CET exam. Okay, so eustachian tube opening, the pharyngeal opening eustachian tube is 1.25 centimeter posterior to the inferior turbinate. So, marking on the inferior turbinate, and that is the answer for this question. To the next question, identify the marked structure, and this image again they are repeating. Already they gave this image 4 times. Now again they are repeating the same image. Now this is an image with intact dura. So now we remove the vault and we remove the brain and we didn't strip the dura. Dura is intact. So in this diagram we are going to identify the cranial nerves. Okay. So now this is the optic canal which will transmit the second nerve, optic nerve. Now you are also seeing one lumen, that is the ophthalmic artery. Now this is your lesser wing of sphenoid and this is the greater wing of sphenoid. Between the lesser wing and the greater wing of sphenoid, we have superior orbital fissure. The superior orbital fissure which transmit third nerve, fourth nerve, sixth nerve and the ophthalmic nerve. But dura is intact, we are not able to appreciate the superior orbital fissure. Now just behind the second nerve, you are seeing this one, that is the third nerve. Okay, and fifth nerve you are seeing here, a stout and broad nerve you are seeing, and this is the sixth nerve which is piercing the dura, which goes inside the dura, which goes inside the cavernous sinus. So sixth nerve, 2 questions you will get. The structure passing through the cavernous sinus. Sixth nerve, it is having the longest intradural course. And one more point, sixth nerve after piercing the dura is passing inside the durilos canal. So these 3 questions they gave about the sixth nerve, and already they gave this question 2020 INI-CET they gave this question, identify the marked nerve, sixth nerve marked, and they asked you to identify the sixth nerve. Okay, and this is the petrous temporal bone. Now in the petrous temporal bone, yes, middle ear and inner ear present inside the petrous temporal bone. Now in the petrous temporal bone you are seeing an opening, that is internal auditory meatus. So 7th nerve and the 8th nerve which is passing inside the meatus, and just behind that is the jugular foramen. Jugular foramen is present at the junction of, yes, the temporal bone and the occiput bone. So 3 nerves passing inside jugular foramen, 9th nerve, 10th nerve and the 11th nerve. So jugular foramen syndrome is also known as Wernicke syndrome. Wernicke syndrome which transmit 9th nerve, 10th nerve and the 11th nerve. So Wernicke syndrome compress 3 nerves, 9th nerve, 10th nerve and the 11th nerve, not 12th nerve. 12th nerve is not passing through jugular foramen. 12th nerve passes through hypoglossal canal. Okay, right. So what is the answer for this question? Where is the marking? Yes, the marking on the third nerve, oculomotor nerve. That is the answer for this question. Now next question, the 60-year-old male recovering from facial nerve palsy complains of food getting stuck between the cheek and the teeth while eating. Now what is the muscle affected in this case? Now see option D, orbicularis oris. This muscle is helping for pouting. This muscle also known as kissing muscle. Zygomaticus major muscle, it is a laughing muscle, yes, helping to express smile, the laughing muscle. Now, musculature muscle is helping for blowing, and also it prevents the food accumulation between the cheek and the teeth. If you have the toddlers nearby your home, you might have seen this. The mothers used to press this area of the toddler. So, the toddlers, if they keep on accumulating the food here, they won't grind anything. So, what their mothers will do? The mothers will pressing this area. So, what they are doing? They are stimulating the musculature muscle. That muscle prevents the food accumulation between the cheek and the teeth. So, that is the answer for this question. So, answer for this question is musculature muscle. LBS, levator labial superior, is not helping for this action. Okay. So, answer for this question is A. Next, from the upper limb. See, I told you the INI-CET exam, NEET exam, definitely you will get one question from the nerve injuries. Okay. So, now upper limb and now lower limb, nerve injuries, sure question. Okay. So, injury of posterior interosseous nerve leads to loss of extension of digit, loss of extension of wrist, C, loss of supination, D, wrist drop. So, now posterior interosseous nerve, it is the nerve of posterior compartment of forearm. All the muscles in the posterior compartment of forearm supplied by posterior interosseous nerve except three muscles. What are those? Number 1, anconeus. Number 2, brachioradialis. Number 3, extensor carpi radialis longus. So, these three muscles not supplied by posterior interosseous nerve. These three muscles in the posterior compartment of forearm. These three muscles not supplied by posterior interosseous nerve. These three muscles supplied directly by radial nerve. Now, what is the action of anconeus muscle? Anconeus muscle, not a main muscle, it is a helping muscle for extension of elbow. Anconeus assisting triceps. Anconeus assist triceps for elbow extension. Okay. Brachioradialis muscle, it is supplied by radial nerve, just now I told you, but this muscle is aligned in front of elbow. See, it is a muscle in the posterior compartment of forearm. So, we have numerous muscles in superficial compartment of forearm. So, because of its alignment, this muscle come more in the front side, this muscle cross the elbow in the front side. We know already. Any muscle crossing the joint in the front side, do flexion. Any muscle crossing the joint on the back side, do extension. The opposite is knee joint and the ankle joint. Muscle crossing knee in front, ankle in front, do extension. Muscle crossing knee and ankle behind, they do flexion. So, that is a different scenario. Remaining all other joints, any muscle crossing joint in front, flexion, behind extension. Now, this muscle, brachioradialis muscle, crossing the elbow in the front side, this muscle is weak flexor of elbow. Weak flexor of elbow. Nerve supply, radial nerve. Muscle belong to posterior compartment of forearm. But what is the action? Opposite action. Weak flexor of elbow. That is why this muscle is called shunt muscle. Shunt muscle. Okay. Right. Now, eccentric muscle. What this muscle will do? This muscle do extension of wrist. Extension of wrist. So, in the case of pin palsy, in the case of posterior interosseous nerve palsy, extension of elbow is normal. Why? Because of triceps and anconeus. Extension of wrist is normal because of ECRL muscle. So, wrist drop is not seen in the pin palsy. Now, what is the deformity you see in the pin palsy? In the pin palsy, we see finger drop, not wrist drop. Finger drop, not a wrist drop. Now, again, they gave this question in the old NEET exams. 2016-17 range I am saying, they gave this question in the NEET exam. Now, almost after 8 years, they gave this question in the INI-CET exam, AIMS exam. So, pin palsy, you see finger drop, not wrist drop. So, finger drop means loss of extension of digit. So, A is the answer for this question. Now, what about supination? Supination is done by two muscles. What are those? Biceps, very good. And number 2, supinator. Supinator supplied by posterior interosseous nerve, agreed. Biceps supplied by musculocutaneous nerve. So, supination is intact in the pin palsy. Okay. So, answer is loss of extension of digit. That is the answer for this question. Now, do you see any sensory loss in pin palsy? No. Why? Post-interosseous nerve, it is a purely motor nerve, no sensory loss. Okay. Right. Now, come to the next question. A 15-year-old boy underwent splenectomy for thrombocytopenic purpura. During the procedure, surgeon noticed bleeding while separating the spleen from the stomach. Which vessel is most likely implicated in this bleeding? A. Left gastric vessel, B. Short gastric vessel, C. Gastroepibloic, and C. Splenic. So, they are asking the structure present between the spleen and the stomach. Ligament is present. Which ligament? Gastrosplenic ligament. So, this stomach and spleen. So, A is gastrosplenic ligament. Okay. And B, there is a ligament between spleen and kidney, left kidney. So, that is renal ligament. And C, there is a ligament between diaphragm and colon, phrenicocholic ligament. C is phrenicocholic ligament. Now, what are the structures present in these ligaments? Phrenicocholic ligament does not contain any structure which will prevent the downward displacement of spleen. That is why this ligament is called sustentaculum lenis. Again, this question they gave you in 2021 NEET exam. Leadorenal ligament contains two structures. What are those? Splenic artery and the tail of pancreas. And the gastrosplenic ligament contains, yes, left gastroepibloic vessels and the short gastric vessels. Short gastric vessels. So, in the diagram, A is the gastrosplenic ligament which contain left gastroepibloic vessels and the short gastric vessels. So, now left gastric vessel wrong, short gastric correct, gastroepibloic again they did not give exact right or left. So, this is not a right answer. Splenic vessels no. So, B is the answer for this question. Okay. Short gastric vessels. Gastroepibloic is right, but they did not give left or right, no. So, this is not a correct answer. So, I have to go for B. B greater than C. Okay. Right. Next, last question. Again, I am saying every year from 2016 AIMS and INI-CET exam, they are getting one question from the lower limb from the gluteal region topic. Even this year, 2024 November INI-CET, they gave question from the lower limb gluteal region. Again, the NEET exam, again I am saying definitely will get a question from the leg region. NEET leg for INI-CET gluteal region. Again, very simple question. During walking, hip bone of the side or suspended leg is raised by the action of which of the following muscle present in the supporting leg? Yes, they are asking about the Trendelenburg sign. Now, what is the muscle? Gluteus medius muscle, gluteus minimus muscle, and what is the nerve involved? Superior gluteal nerve. So, what is the answer for this question? Gluteus medius muscle. That is the answer for this question. So, these are the questions you got in the recent INI-CET exam. Again, this INI-CET exam we got more questions from the embryology and histology and the neuroanatomy, and very few questions you got in the upper limb. Only one question we got, lower limb one question, abdomen pelvis perineum again only one question, no question from the thorax topic. Again, they did not give any question in the sequence origin pattern, and they did not ask anything about the anything from the match of following type. Again, they did not ask anything in the multiple answer type questions. True or false statement also we did not get it. Okay. So, very simple direct questions we got in the recent INI-CET exam. So, that is all guys. See you in the next session.